Good afternoon to everybody. My name is Vanessa. I'm working for UniSalute. UniSalute is a private insurance in Italy that specializes in collective policies. I would like to introduce UniSalute. UniSalute is a private insurance to deal exclusively with health insurance and have 4.8 million of policyholders. We manage over 90% of domestic fund for employee and workers, fund for professional and company mutual funds. In this slide, you can see the representation of the division of the insurance market in Italy. There are 8.5 million policyholders, and UniSalute take care of 23% of these. How we work? UniSalute has 3 call centers. One that deals with the reservation visits, 1 call center that deals with the management of hospital admission, and 1 call center operation 24 hours a day, 7 days a week that provides medical care and services with special attention to customers who use long-term care coverage. We have also 45 doctors that directing customer and quality assessment for admission to partner health facilities, a website, and independent scientific committee. In Italy, the national health system is public and funds for its sustenance comes from taxes, but the health spending are too high to be sustained in light of the continuous cuts being made to raise funds for other sectors. And workers have the possibilities to pay for integrative health care. Funds concluded at regional level, managed by UniSalute, may be of 2 types, supplementary to the national health system or replacement of this. UniSalute work with a network of partner health care facilities directly managed by a dedicated team staffed by UniSalute, which ensures a constant monitoring of the quality of health care and allows to obtain lower prices than market prices. The facilities are spread through the country and offer a comprehensive, high-quality service in terms of medical professionalism, healthcare technology, and comfort. The advantages for insured persons receiving of health net are direct payment by UniSalute of the medical performances, the possibility of book directly by choosing between professional of trust agreement without waiting time and confirm the appointment within 24 hours. UniSalute obviously being a private insurance, and we are strongly involved to control cost, and our internal processes arise as a goal to prevent waste since the insurance premiums are charged to the workers. Is looking to provide benefit of high quality in a reasonable time with the constant monitoring of fees applied by our agreement and monitoring of customer satisfaction. In the light of this process, management UniSalute has decided to build a path to be charged in a global way the assistance of those customers who benefit of long-term care guarantee. This is the life expectancy in Italy. Demographic projection for European countries show that in 2060 the population will be numerically unchanged due to the low birth rates, migration, and the constant increase of longevity. However, will change significantly the ratio of people of working age, and those over 65 years that will become 4 versus 1 to 2 versus 1. And this change impacting on the social system, pension and health. The increase in life expectancy and mortality reduction for scientific advances have led to an increase in demand for assessment for loss of the self-sufficiency due to the seniority, which result in an increase in public expenditure on long-term care. This reduction of funds for long-term care has led to a reduction in hospital beds to raise more money to redistribute funds. Obviously, these are caused an increase of non-sufficiency persons that cured at home. However, the national average for home assistance in Italy is 1.5 hours per week. Due to the current situation in Italy, the families don't receive the skill they ask for. The welfare state is not appropriated to the needs. Costs are rising, but decreases the assistance due lack of the resources, and the assistance is likely to remain an issue in women's hands. It's necessary to rethink and restructure the support to the health system and social need of dependent persons through a forecast for long-term care, as well as the remodeling of the use of public spending. In the light of this, even if later than other European countries that have taken steps to manage the problem of maintenance and economic assistance to the elderly population, in Italy, in 2009, the Sacconi law provides the obligation to allocate at least 20% of all resources committed by the fund for the social and health services for people not self-sufficiency. And for this, UniSalute introduced in our warranties insurance coverage for long-term care. In this slide, I wanted to highlight the increased income that is occurring after the application of the Sacconi law, 22.3 million euro. Insurance that have received this warranty was 164,000 and enjoying coverage for long-term care, home service treatments, physiotherapy and dental care. This is our process. UniSalute, through the figure of a case manager, is me in UniSalute, takes charge of the not-sufficiency customer and carries a first contact through a telephone interview, during which collect information about the need and the real interest, the management of paperwork to provide to the family a first aid and framing the situation of the person. Then, through a home visit, the case manager uses inter-array home care system for the evaluation of the person, thereby identify the trigger on which action focus. The case manager with the family has decided what kind of assistance is required under the areas identified problems. UniSalute uses this evaluation system for all our customers on the whole Italian territory. The choice of inter-array is also being made in relation to the huge diversity between North and South Italy in connection with the services provided to have an assessment that can integrate the service by the national health system and those provided by UniSalute. Having agreed assistance, UniSalute, through the call center open 24 hours a day, take care of the agreed dates and time more comfortable for our customer, order and also to check that the benefits are provided in the best way. If there is the need to change the plan, shall submit to the case manager the welfare issue. Inside the maximum monthly available insured, which vary depending on the bill, the case manager will agree with the family and the patient benefit assistance needed that will be paid directly from UniSalute. However, the benefits that not belong in the group may be provided by UniSalute agreed prices paid directly for the patients. Since this process makes a timely and effective management of assistance, we also apply the process to get in need assistance for post-hospitalization and people who suffer serious consequences after a car accident. In 2030, we managed 194 cases of long-term care, 17,000 cases of post-hospitalization and 19 cases of serious injury by car accident. We have agreement on the whole Italian territory about 13,000 healthcare professionals of proven experience, nurses, physiotherapists, doctors, and all figures involved in the process and assistance that are required for the management of long-term care. Unlike the national health system, where the management of the person is bureaucratic at the service of the system, UniSalute is looking to put in the core of our process the customer, the person. We are at the beginning of our work, and we will surely make errors, but we strongly change the management of long-term care, collaborating with both the national health system and the European state member to address social change that now are inevitable. Thank you.
No questions?
Hi, I'm Karen Fisher from Australia. So I've been involved in coordinated care trials in Australia where private health insurance were involved in this too. Is it one insurance package for health and long-term care? Or
Yes. There is a package of long-term care insurance there. This is comprehensive of social needs, medical needs, and everything is the possibility of the patients. Inside the maximum of monthly. The insurers have a maximum of percentage at monthly, and we paid for this one. But every social and medical needs.
So what happens when they exceed the maximum?
The patients pay directly, but with the UniSalute prices. We have a discount from the rates, and the patients pay directly.
So what happens when expenditure exceeds it? So I noticed you included disability injury in there.
Yeah.
And the private health insurance companies could not accept that risk. So if you have a catastrophic injury, for example, that may be several $1 million expenditure.
We pay only to the warranty agree in the policies. We pay only this one.
So what happens if you?
I don't know.
So other questions?
So I didn't quite understand what services were being offered. Do you provide nursing home care?
No, the nursing home care, medical visit at home, physiotherapist at home, transplantation to the hospital, from home to hospital, and a bureaucratic help.
What about home care, personal care, not skilled nursing from a registered nurse, but just help with eating, bathing, dressing?
Yeah.
And how much does the policy cost?
It's a collective policies, not individual policy. The individual policy, it's cost $2,500 for 1 year, but we make but we make only collective policies. It costs, I suppose, half is paid by employer, half is paid by workers. and its cost about is depend. There is very rich policies like the lawyer policies, and a poor lawyer like in Italy, a poor lawyer that is for 50 euro at in a year to is 200 in a year the cost.
And what level of disability do you
yes,
have to
yeah,
to qualify?
we have there is a questionnaire that 3 to 4 activity day of living. You have to not self-sufficiency. It's about 3 of the 4 activity day of living. And in Italy there is a system to examine the person that this medical system gave to the person a percentage of invalidation. I don't know if you understand.
An assessment?
Yeah, an assessment. And we have the person who has that has under 60% not hearing coverage.
So I saw most of the patients were receiving post-hospital care.
Yeah.
So it is, I don't know if you know the terms, but in the United States we call that post-acute care.
No, it's not in the same system. No, is care about physiotherapists, post hip surgical nurse for.
So after
a recovery of a
hip replacement or a stroke.
Yeah.
So that seems, is that not covered in the Italian insurance plan?
Not for a very long time. The national health system provides for 1 month, but it's necessary more time to recover before a hip replacement. And we gave that person, the physiotherapist, the orthopedic at home to
Who are the insured? Are they still in the workforce, or do you have in the group some retired?
No, the group full.
So they're still working?
Yeah, they're still working, yes.
And is there a chance for these people when they retire?
The coverage of long-term care continues after the retirement. It continues. If you have in coverage during your activity life, the policy continues when you retire.
If the employer keeps paying?
Yeah.
Other questions?
So what is the government reaction to this?
Oh, we want to work with the government, but it's so difficult because because they want to conserve at the government's level everyone, but it's not possible because we have no funds. In Italy there is a very critical situation, and the government don't let the situation go. We don't work without government. We work with governments, but the governments not gave us the opportunity. Now we have to try to speak at the regional level. It's too easy to speak.
Okay, any last questions?